Hello and welcome to Wellbeing. Of course, you know that Wellbeing is a program that encourages healthy living, not just just because you have the sickness, but then it encourages healthy living in terms of mentally, financially, physically, spiritually. My name is Imogen James, and I told you the last time that we are starting a series titled "Before." After pregnancy. But before I unveil my guest to you, I would like you to watch this video and get your mind prepared. Don't forget to pick your pen and your diary because you're going to have to learn and write so much. And also try as much as possible to subscribe to our YouTube channel. Do it now while we are going on this very short break. Go to our YouTube channel at Spectrum TV Live.ng and then follow us. I'll be right back after the break.
Pregnancy is the time period during which a baby develops inside your uterus. It usually lasts about 40 weeks, starting from the first day of your last menstrual period. These 40 weeks are grouped into 3 segments, called trimesters. The first trimester lasts about 13 weeks. During the first 2 weeks, you aren't actually pregnant because of the way your due date is calculated. But your body is preparing for pregnancy. During the second week, an egg is released from your ovary in a process called ovulation. Around the end of the second week, the baby is conceived in a process called conception or fertilization. This happens when a sperm from the father merges with the egg from the mother, usually in the fallopian tubes. During conception, genetic material from the mother and father combine to form a unique genetic code, instantly determining sex, hair color, eye color, and hundreds of other characteristics. This new single cell, called a zygote or embryo, is the beginning of a new human being. During the third week, the zygote divides to form a hollow ball of cells called a blastocyst. The cells of the blastocyst begin to arrange themselves into 2 groups. The inner group will develop into your baby, and the outer group will form tissues to nourish and protect it. During week 4, the blastocyst moves into the uterus, where it hatches out of its outer layer. Once freed from this outer layer, the blastocyst can embed itself in the thickened lining of the wall of the uterus in a process called implantation. Weeks 5 to 10 are referred to as the embryonic period. All of the major organs start to grow, such as the brain, spinal cord, and heart. The heart begins to beat during this period. Structures called the placenta and umbilical cord begin providing life support for the embryo. They bring nutrients and oxygen from the mother to the embryo. Bones and muscles start to grow beneath thin, transparent skin. Toward the end of the embryonic period, the embryo starts to look more human. At the end of week 10, the embryo is now called a fetus and is about 1 1/4 inches long from head to rump. During the next few weeks, the arms and legs grow longer and start to move. Fingers and toes finish developing, and the baby's face becomes well formed. By the end of the first trimester, your baby is almost 3 inches long. Your body experiences many changes during the first trimester. This is due to changing levels of chemicals, called hormones, circulating through your body. The most common first sign of pregnancy is that your menstrual periods have stopped. You may have other symptoms as well, such as nausea, often called morning sickness, that can occur at any time of day, tender, swollen breasts, mood swings, constipation, weight loss or weight gain, craving or disliking certain foods, and feeling more tired than usual. You may have only a few of these symptoms, or none at all.
Pregnancy is beautiful, they say. It's a miracle, they say. Well, sure it is, but it's also painful, and they have clearly never carried a fetus to term. Many women admit that they never truly knew the power of their body until they gave birth, and it all begins with fertilization. Pregnancy is long, and in those 40 weeks of gestation, the female body changes in some surprising ways. Every single organ, muscle, and joint is affected, shifting and moving to accommodate the tiny human being growing inside of you. Your heart pounds in your chest, pumping around 25 to 50% more blood through your veins and arteries. Your hormones skyrocket, the catalyst for every change you experience. These hormones, relaxin and progestin, cause your muscles to loosen up to accommodate the growing baby. And we're talking about all muscles, from your abs to your digestive tract muscles. So don't be surprised if you experience constipation in early pregnancy. Heartburn and acid reflux are also common side effects of pregnancy, thanks to looser stomach muscles, which let acid loose into the esophagus and up into the throat. This can really aggravate morning sickness, but that's also hugely attributed to the HCG hormone, meaning morning sickness can really be anytime sickness. Some women even develop a severe case of sickness called hyperemesis gravidarum, caused by rapidly rising hormone levels. You might have also heard of the mucus plug, which develops quickly after implantation to protect the fetus by keeping germs and bacteria out. The mucus plug stays in place until labour is close, but don't be surprised if it falls out several days before you go into labour. You might also notice that your breathing is a little faster than normal when you're pregnant, and it's not necessarily because you've been too tired to exercise. Pregnancy causes your diaphragm to expand, which can make breathing more difficult. But your body and nature have a plan for that, releasing more progesterone to stimulate the respiratory system and help you and your baby get plenty of oxygen. It's important to remember that your body is genetically programmed to keep both you and your baby safe, and that means making sure you both have enough sustenance to stay happy and healthy. For this reason, the kidneys are known to retain extra water and salt during pregnancy, instead of filtering these out as they normally would. This is what causes your blood volume to rise so much. Your body wants to make sure your baby has plenty to eat, which is why it's not uncommon to experience a deficiency in iron, among other nutrients during gestation. They're all going to your little temporary tenant. While pregnancy is long, and it's not always easy, it's not forever either. And the good news at the end of the day is that all of these changes start to reverse even before you go into labour.
Good health, they say, is something you can't buy. But the decision to live healthy is a choice that you'd have to make. Join health practitioners from diverse health fields as they provide you with vital information to help your day-to-day health decisions. Well-being, your wellness talk show. Well-being airs every Monday, 7 to 7:30 p.m. only on Spectrum TV.
Welcome back to Wellbeing. Of course, I said that we started a series titled Before, During and After Pregnancy. And if you've been following us carefully, last week we talked about before, everything you need to know before you start this journey. And congratulations to you if you just got pregnant. And if you're like me that is still believing God to get there, well, this particular segment is for you because we are going to know how these things work. I know they taught us in biology, we have seen pregnant women, but today I'm very privileged to host Nurse Uduakwili, and she's going to take us on all the journey of pregnancy, the first trimester journey. So join me today as I welcome Nurse Uduakwili.
Thank you very much.
Thank you so much, ma, for coming.
It's my pleasure.
Okay, so let's just hit the ground running. Let's start with a very simple of them. I know that you're actually a mother, so you've actually experienced this and you've read about it, and you've also helped other women out there. So for the sake of, I don't want to assume, how does the whole pregnancy thing happen? How does it work?
Okay. Pregnancy occurs when two people of childbearing age actually have unprotected sexual intercourse.
Okay.
When the sperm hits the ovary, following this intercourse, and then fertilization occurs. So that's how the whole pregnancy occurs.
Okay, so let's begin with trimester. What is trimester and why is it broken into 3?
Okay, trimester is just summary, is a period of 3 months actually. I think it's broken into trimester to make it easier for women to know. That's the easiest way that you would know, okay, this is what I'm going through. this is what happens for me during this phase. The next phase comes, you know what to expect, what happens, and then the last phase. So trimester is just usually a period of 3 months. It's not only common in pregnancy, but sadly, we have dedicated that particular word for pregnancy.
Yeah.
Yes, because there's other things that you can call trimesters, like maybe in academic session. But for now, since we are talking about pregnancy, it's just a period of 3 months or approximately 3 months, not necessarily maybe whole 3 months, because the first trimester or the trimester is not necessarily just a period of 3 months. It has sometimes it extends to 12 weeks, which is 4 months, but it just divided into 3.
Okay. So the first trimester, how many months, how many weeks is it, and then what happens during that time?
Okay, the first trimester is the period from conception, from when the woman finds out that she's first pregnant, to about 12 weeks. So during this time, a lot of changes occurs in women, and these things are different for different women.
Yeah.
Because we all have different hormones that works for us differently. You know, some women of childbearing age, while some people have menstrual cramps, some people do not have. So that's why now it's even common for women to be pregnant and they're not aware.
Yeah.
Some women get pregnant and they're still menstruating. Some people get pregnant and these changes that you expect do not occur. Because personally, from experience, the whole of first trimester, I didn't feel nothing.
Wow.
I was literally watching out for this thing they would say, morning sickness, you know. I didn't feel nothing. So it's different for different women. But some women have some symptoms that gets bad or maybe it's extreme in them. Some women actually go through that first seamlessly, while some have it hard and later in pregnancy, some people have it really easy. So during this first trimester, what you expect is mostly absence of menses, which is usually the first sign. When a woman doesn't see her period as they're supposed to, now that okay, fine, something has happened. Another symptom that you would see might be enlargement of breast. These changes are hormonal. It's not because of anything, it's just the hormones that works during the reproductive cycle. And then another could be excessive cravings, and then morning sickness, what we refer to as morning sickness, where the common symptoms is nausea, vomiting, the things you used to like, you don't like them anymore. You like weight things. And another symptom would just be waist pain. You'll be feeling like your cramp will come, but then you wake up every day, it's not coming. And some women occasionally bleed during this period. It calls implantation bleeding, when the embryo is trying to settle into the uterus. So women actually experience some spotting, not actually like large blood clots, spotting bleeding, and we call it implantation bleeding. It doesn't last like the normal menses. Some people 2 to 3 days and it stops. So those are the common changes that occurs during this first trimester.
Okay, so I know that I've heard stories. My mother has actually told me one that when she was pregnant, she did not know, but she took malaria drugs thinking it was malaria. So is it true that whatever you do at this stage could be harmful to the child?
Yes. Whatever you do during your first trimester is very delicate. Like, that's the beginning of pregnancy. And people get lucky. Like I said, it's different body systems. Some people get lucky. The thing that works for this person might not work for the next person. Yeah. So someone will take that anti-malaria. I remember someone telling me that when she feels like she's going to get pregnant, she takes anti-malaria and the thing comes out. I don't know how that works. But then I'll still liken it to people's system being different. People take the anti-malaria and it affects the child's development, From that first trimester, you see a child come up with some congenital abnormality. Some tablets that you take, whatever you do during first trimester has a lot of effects on your child. Sometimes it even threatens that pregnancy. So it's very delicate, and everything you should do, especially if you're someone that was consciously trying to conceive. There are some people that you're not conscious. Yeah. You're just having fun and then it happens. But then when you're trying to conceive deliberately, maybe you've been to a gynecologist and you're following up some procedure, you have to be very careful about whatever you do during this first trimester, especially if you are on some kind of fertility treatment. So you have to be very conscious of what you do. And taking note of your cycle and marking your calendar and keeping dates could help you not to make mistakes or errors during this first trimester. Okay, so
this first trimester, is it when the baby, how does the baby look like? Is it when you can determine, oh, this is a boy, this is a girl? No. This is when the eye comes out, the nose and all?
Okay, during the first trimester, not necessarily like the first month, not the second month, the third, maybe towards the 4th month, you can see that the baby is about 1/6 inch long. The brain has started developing, the trunk, and then some bud that will form other organs like the ear, the eyes have started coming out. If you've ever seen someone have like a miscarriage during this period, you will see that baby, was already formed. It's just that these organs are not developed. Sometimes it's just, for example, a plant now. When you plant a corn, a seed, the seed of corn, when it comes out, that first thing is not corn.
Yeah.
Yes, that's how it works for pregnancy too. The first thing that comes is not a fully developed baby. It's just parts that will form into this fully developed baby. So at that first trimester, maybe towards the end, you can't determine the sex of a baby. Like you might be wrong. Yes, because the reproductive organs are not yet formed. That's like the last thing that comes out during pregnancy. That's why you don't even check for that during the first trimester. You just check if there's something in there, if there's something growing, and then the baby is just about very little. Yes.
Great. Okay, so I know earlier you talked about symptoms and morning sickness was part of it. So how were you able to, did you have morning sickness? And if yes, how were you able to manage it? Because I've literally seen this cripple so many young women.
Yes. Like I said, it's a bone. It works for different people. Like with my child, I don't know, I cannot relate, I don't understand. So, but some people, I've seen women in the hospital with morning sickness. Morning sickness is, however, normal for some women. It's characterized by nausea and vomiting.
Okay.
So that first symptom of morning sickness is always nausea. I feel like vomiting, but these women do not actually vomit.
Okay.
They just have this feeling of discomfort, nausea, vomiting. So women actually vomit. And then there's a severe case where it's worse, where it cripples you, and you cannot tolerate anything. You know, at that point you're not tolerating anything. Your baby cannot grow well, so you will have to be admitted. That's the point we call hyperemesis gravidarum. That's actually a sickness on its own. Whereas the other morning sickness is just a symptom that can be managed with your dietary changes.
Oh.
Yes, yes. Dietary changes is what will help you cope with morning sickness. And then, as compared to hyperemesis gravidarum, there's nothing that you do that enters your stomach. Nothing, no matter the years. At that point, you need admission in the hospital and treatment, fluid, and monitoring. But if it's just morning sickness, nausea, vomiting, waist pain, you know, weakness, fatigue, tiredness, it can be managed. Yes, progressively.
Okay, so you talked about dieting. So I just want to know, what are those diets that you are supposed to, watch out for in a first trimester period?
Okay. The first trimester, I can't
vitamins, because I know people take vitamins and supplements. Is it even advisable for someone to take vitamins and supplements during that period?
Yes, and like I said, it's your gynecologist that determines what works for you.
Yeah.
Some people take these vitamins that sometimes is prescribed for one person. That's why it's not proper for you to take. This person took this. I want to take this. Yeah. Someone took Pregnacare. You want to take Pregnacare. You don't know how your hormones work. You go and trigger the other hormone that is supposed to be suppressed during pregnancy. I'm just saying it in layman's language. There's an hormone that comes rises during pregnancy and one is suppressed. Okay. So now you're not taking the supplement and then you're tampering with your own hormonal system. Sometimes it leads to miscarriage for some people. So it's advisable that you talk to your gynecologist before you take any supplements during pregnancy. But the most important thing that is advisable for women to take, which women disregard, is folic acid. Smallest thing like folic acid, up to 600 microgram, can help in development of the spinal cord and the brain. Like I said, the brain develops during the first trimester. So when you take this folic acid, it helps your baby to develop very well. You know, after a period of time, you can discontinue, it can be stopped. But folic acid is one of the most vital mineral and vitamin that you take during pregnancy. You know, may not necessarily need other maybe big name supplements, honestly, but folic acid is very vital for the development of your baby. And then for food, when it comes to diets during pregnancy, you take healthy foods. For someone that has morning sickness, bland diets are advisable, like fiber, cracker, biscuit. You know, this morning sickness does not last all through the day. As the name implies, it's just morning. After a period of time, it will subside. So you have to identify what works for you. Would Quaker oats work for you? You might not need milk because dairy products can trigger it. You might not need milk. Does Quaker oats work for you? Does cracker biscuit work for you? Just take that, drink water, you relax, you rest, you do some mild exercise, and then you rest. After a while, you can take what you have to take. And then what you eat in the night would also affect what happens in the morning. You cannot be taking fries, you know, eating fries, enjoying yourself, and then in the morning, there's someone that is already having morning sickness. This thing will trigger. It will add up to your symptoms. So for diet, it's advisable that you eat what works for you and what is healthy for you.
Good health, they say, is something you can't buy. But the decision to live healthy is a choice that you'd have to make. Join health practitioners from diverse health fields as they provide you with vital information to help your day-to-day health decisions. Well-being. Your wellness talk show. Well-being airs every Monday, 7 to 7:30 p.m. only on Spectrum TV.
And then when we talk about diet and we go about to talk about fruits, people are not careful to ask, what fruit can I take during first trimester? Some people, actually, it's not advisable to take pineapples during first trimester.
Why?
They believe that pineapple contains something that is oxytocin. You know, oxytocin is a drug that is common in causing contractions. People take pineapples and then they miscarry their baby because this property in pineapple can trigger, among other things. You have to talk to your gynecologist most of the time to know what can work for you during first trimester. While some people will take it and escape, you know, doesn't happen for them, and then it's not just okay for you to, you know. And then with the latest research coming up and the evolving world, we have realized that some of these things could actually be one of the causes, some of the causes of miscarriages we have during the first trimester. So when you're going to meet a gynecologist, you ask, what fruit can I take? Banana. There's so many other fruits. People love pineapple, but you have to warn yourself and caution yourself. And you know, people do not take zobo during first trimester. Zobo causes a lot of threatened miscarriages in first trimester of pregnancy, and most of the time it's because of the pineapple that is added in preparing that zobo drink. So basically that.
There's something that she kept saying, and it's something that we all, it's literally like, if you've watched Wellbeing for a while, you could literally sing with us, go and see your doctor. But in this case, you have to go to a gynecologist. I know most times, I know maybe your friend is a doctor, your neighbor, that midwife, a retired nurse, she has helped so many people, you know, deliver and all. But for you to know how your hormone works, go and see a gynecologist for yourself. See all the rules. Like, my heart is just beating. See all the plenty rules in first trimester. Don't check this, don't breathe like this, don't sleep like this. Anyways, no, so what about exercise? Is it healthy to start exercising during first trimester? Can I go about my daily activities, or there are some things like do not do?
Yes, you can go about your very normal, healthy life, but for the exercises, it has to be very mild. People's body system are actually very different. For somebody that has, for instance, incompetent cervix, your cervix is not just even going to carry that baby. You might not need something very rigorous. For someone that has previous history of miscarriages, you might not need to do so much of exercise during your first trimester. For someone that is at risk, because there are risk factors, age. For instance, if I am advanced in age and I'm pregnant, bed rest is the best. You just go on bed rest, and maybe it's just small walking. You know, exercise doesn't necessarily mean you have to carry things. I mean, now the internet is not even helping us. I've seen pregnant women do very strange things.
I've seen them dance.
They go upside, they turn their head over. I'm like, how you were able to do this? But please, before you try that, talk to your gynecologist. Know your history before conceiving. You know, if you've had failed pregnancies before, it's best you just rest during your first trimester. And then the stress might not be good for everybody. While some people are very active, or even more active, the energy you have, you can't even explain it during that first trimester. But it's advisable that you do not do everything. You do not do everything. Lifting heavy loads, you know, farming doesn't work for many people, but some people still go to the farm. You say, what of those people in the village? You are not those people. You're in the town, and then they're trying to conceive. So you have to take caution and know what works for you. You are not an exercise person, and then you are just conceiving, and you think that's the best time to start exercise. Take caution.
Personally, for me, even without beetle, me, I know I'm of the bed rest, you know. I'm of the best bed rest tribe. I won't even, I mean, even if I have to do all those things just for the gram to get, just to take pictures and all. But then it's very advisable. I think one of the mistakes I've seen pregnant women do is just, okay, my sister did it, let me also do it. So it's very, very advisable for you to have a personal gynecologist on this journey. Now let's go over and talk about fetal development. So what are those major milestones in fetal development during the first trimester?
Like I mentioned that earlier, during the first trimester, the brain, the trunk has developed in the baby, and then the bud that will form other organs like the ear, the eyes are coming up too. And then it progresses like that till they get to 12 weeks, and that way the growth is rapid. From that 12 weeks, you will see everything. You can go to the hospital then, and then the scan will be able to detect the sex of your baby, the baby's weight, and every other thing that you might want to know at that stage of pregnancy. So it's just between that first trimester and the second trimester that everything happens. But in the first 4 weeks, the baby has developed up to about 1/6 inch and about few 0 point something kg, 0.1 kg or so. You can have that about that.
Okay.
Trimester.
So I'm still on that. How important is prenatal care at this period? And then during this period, what are those things that everybody in their first trimester is supposed to know during their prenatal?
When we talk about prenatal is before conception. No? So we are going to talk about antenatal.
Okay.
After I found out that I'm pregnant, that's the period we call antenatal. So prenatal is before conception. We can use the both terms interchangeably, but when we just say before conception. So during when you're pregnant, that's antenatal now. We have a kind of an arrangement that we call focused antenatal care, which implies that a pregnant woman must visit the hospital at least 8 to 9 times before delivery. That means your visit is scheduled based on what your gynecology finds out per time you visit. Okay? And then doesn't stop you from going to the hospital every other time you have any discomfort. It's just best to go to the hospital when you have a discomfort. But normally, because even right now in the hospital, we are trying to implement a system whereby you come to the hospital and then you've not done up to 3 or 4 visits. We are treated like somebody we call stubborn people. They don't want to hear word. And in the baby, we call them word through tongue. We call them through tongue. They don't want to hear word. Because at that time, the doctor will not have enough history concerning that pregnancy journey. But if you follow through your antenatal visit, we have very good private hospitals in New that make sure that you follow through your visit, and every visit is very entertaining. You have something to learn, because you can go this week, you're very normal, and the next week something else has happened. Okay. That's the funny part. So these visits are not cumbersome. They make it very flexible. If you go today and maybe when you found out you were pregnant was like 1 month, they won't expect you to come every time, like 2 months, 10 months. They might give you like a 4 to 6 weeks duration to be at home, and then you come back and we monitor progress. So it's very important that you visit the hospital at least 8 to 9 times. And you know that during these visits, you get what we call SPD. That's the anti-malaria treatment. You're able to get your SP, you're able to get your vaccines, Okay. So it's best your visit are scheduled when you attend to them as promptly as you ought to. So that we were able to monitor your baby's growth and the progress you're making, whether your baby is up to date, like or too small for date, and other stuff like that. And from experience, I remember one of those times I went to the hospital, everything was normal. By the next visit, it was realized that my placenta was low lying, that the placenta was lying before the baby. Okay. And at that time it helped us already to start planning the method of delivery. Because when the placenta is lying before the baby, it means you cannot even push out this baby. You can't even try pushing out the baby.
So one of the importance of this antenatal care is that it gets to let you know how delivery process would be. Like.
Yes, it helps you make decisions, informed decisions, because like the hospital where I booked for my antenatal, scans were done at every visit. Okay. So that way it keeps track of whether your baby is too big. If your baby is too big, they'll start telling you this baby is already too big. You either reduce what you're eating or you start planning another way of delivery. They make you get ready. Okay. And at every visit, they'll tell you, okay, everything is okay. Your baby is appropriate for age, appropriate and stuff like that. And at that time, it's able to detect the baby has any congenital abnormality. So it helps you in those visits where you attend them promptly to know when there's a problem, whether you have anemia. You're not looking okay, your doctor will tell you, oh, your blood is low. You do tests when you go for those visits. You don't just go. You do tests, and then they check your weight, everything.
What about, I know that there are some women that do not believe, that women who like, I don't know how they call it, they like home delivery. Because, they just say, the nurses are always very rude to me, they're very harsh to me, so that's why. So what about women who do not buy the whole antenatal journey? What's the plan for them? How can we help them?
The government has also worked in that aspect, because we tried to also train some traditional birth attendants, because it's just natural that in the rural areas it's different for the urban women, but in the rural areas they will still prefer that TBA. They know that traditional birth attendant, they know that woman that used to give birth. So I think there was a program that integrated them into the care of these women, which means that they came. They were trained, and their home, they checked what they have at home, if they are competent enough to conduct home delivery. That way they also affiliate them to a hospital, so that in case you have any difficulty, please refer this woman to this hospital, and then we are aware, so that when you come, they are attended to promptly. that are certified get, because it's actually very difficult to change the mindset of people in the rural areas. So as these women are aware that when this thing is beyond me, I move to the hospital. It's easier now. You will now be able to reduce mortality rate. But hence you believe that anyhow the woman must put to bed in that particular place. That's where we have problems, and we continue to have maternal mortality, mostly in the rural areas.
Okay, so because right now as you're talking, you know, a picture just ran into my head. I know I've seen somebody who does home delivery, and then when the labor gets worse, I see her refer, like she goes to the hospital. Sometimes I wonder, I mean, why did you go through all these stress? But what are those key things that you can miss if you do not go to antenatal in the hospital? What are those things that, you know, you are definitely going to miss out? Probably money or something.
No, the money for antenatal is actually very easy these days, so I'm not sure it's money. Anybody that doesn't go to the hospital doesn't just want to go, and maybe doesn't have people around giving them good advices, because if you have people giving you good advices, you should move. They should even give you support to go to the hospital. It's actually very pertinent for you to go to the hospital, because that will help you know your method of delivery. That will help you prepare for delivery. That will help you know your date of delivery. People don't know their date of delivery. They don't even believe their date of delivery. Sometimes they come and you see them give birth to very old, fragile baby, and sometimes it's just God's mercies, you get, that these babies come out, because some babies when are actually post dates. When you come to the hospital, we might not exactly be able to know your expected date of delivery, but if you give us some certain information, we can just work with that. We can work with that and try to estimate, try to find out, okay, this baby should come out between this date and that date. And afterwards, after a while of pregnancy going, we can now send you for a scan. When the scan cannot tell us, okay, this is actually the date you are expecting this baby. And we give you a time frame that if the baby doesn't come before here, please show up at the hospital, let's do something else. So you actually miss out on that information, especially if you don't even know your expected date of delivery. You can actually end up giving birth to a fresh stillbirth. That's a fresh dead baby. You would miss out on your health, your well-being, your emotional well-being, because it's very important. The support you get when you show up at doctor and see other women, some of the during antenatal visit, they share their experiences. You see women that have given birth 4 times, 5 times, they'll be able to give you, especially if you're a first-time mother, you get the support. I see women very happy when they come for antenatal visit. Some of them, they leave the house very angry with their spouses, but when they show up at the antenatal, they are very happy, they are bubbly, because they see other women who literally sometimes have the same experiences. This that support, you would miss out on it. And then you eventually get contact to childbirth. Doesn't just end after giving birth. You meet new people. The people that I still communicate with from antenatal, we became friends, we know. And first time mom, you will need them when how did you do with this, your baby? My baby is having this. You will be able to get good advice, because people are actually listening and hearing the same thing. The thing you might not have heard very well, she heard it. Or what the doctor say we can do in this situation, the woman will be able to communicate with you. So beyond just the period of pregnancy and delivery, you have good connections and good relationships, and then you're able to deliver safely. The aim of every pregnancy is mother and child alive. So that's the end. And then a very successful postpartum period, because people can actually have a very good pregnancy and they have very stressful postpartum periods. What you do during pregnancy, before pregnancy, during pregnancy, affect after pregnancy. So I think the benefits are enormous, and it's just important that you go to the hospital to partake in this benefit.
Thank you so much, Nosudwak. So I mean, that's coming back to you now. The importance. So if you know someone who is pregnant, literally for me, I buy going to the hospital more than any other thing. I come from a family where literally everybody's in fact, everybody, I'm the only art person. But if something happens to me, I'll go to the doctor and talk to the doctor about it. So I don't know about you, but then if you know any pregnant woman, or you're pregnant, or you're, you know, like I said earlier, believing God to become pregnant, look at all the benefits of antenatal. Like, look at how it's been streamlined. To me, I used to think that antenatal is just a time where they just bring you together and give you drugs and all that.
No. Run away. That's the last thing.
So seriously, because when I go there, I just see them seated there and then they are with fell. So I'm like, maybe just want to give them drugs and
that's the last thing. The last thing. When you come find out, the first thing is not drugs. The first thing is health education. You're taking time, that they take time after the spiritual section where they pray with you and pray for you. They take time to educate you on the things that you need to know, the things that you can manage by yourself at home when it happens. The symptoms of labor, the signs of labor, you will not know until you've attended antenatal. And then for every pregnancy, no matter how many times you think you're pregnant, it's different.
It's different.
Yes, it's different. You can actually be waiting for a lot of water to burst, and then here you are waiting, not knowing that your water is just very little, and then the water has come out, and then you didn't notice. You probably just went to bed and the water has bursted, and you didn't notice. You could just clean it off, and then you're already in labor. People deliver just at the entrance of they come to the doctor and they're delivering on the doorstep, on the corridor. This thing has happened and they didn't notice. Some people actually have very painless labor. The first labor could be painful, but the second one you have very painless, swift labor, spontaneous delivery. So you come to the doctor and then you're already delivering on the corridor. Your baby is being no so.
Wow, this thing is true. And I see people say, well, I've not really believed it.
No. A lot of times we have delivered on the hospital gate, at the hospital gate, on the floor, in the corridor. There was one that delivered twins on the floor, because you will not feel that you're expecting a particular thing to happen.
Okay.
It doesn't happen like that for every pregnancy. So it's beyond the drug is the last thing. The drug is just your routine drugs, multivitamin. You do test about hair. So people come there and they're just realizing, oh, I am HIV positive for the first time because of the tests you're exposed to during pregnancy. So it's beyond just coming to get drugs. You come, you get educated, you do tests, you know your blood level, where they can carry you through, and what you can do to help yourself, and then your status. And that will help you and help your baby a lot.
Yeah. So
those are the benefits.
I don't know about you, but then taking a deep breath, we're going to go on a short break. When we come back, we're going to talk more about miscarriages. I used to get miscarriage. Is it really true that they busted this shell in the realm of the spirit? We are going to know that right after the break.
Good health, they say, is something you can't buy. But the decision to live healthy is a choice that you'd have to make. Join health practitioners from diverse health fields as they provide you with vital information to help your day-to-day health decisions. Well-being, your wellness talk show. Well-being airs every Monday, 7 to 7:30 p.m. only on Spectrum TV.
Many thanks for staying tuned. This is Wellbeing. In case you're just tuning in, I'm serious. You have missed a whole lot. And I know that you that watching us right from the beginning, you've been taking notes and nodding your head and taking a deep breath like I am doing it right now. Okay, so let's go over to the next question. I said we're going to talk about miscarriages. So now, what are the causes of miscarriages during pregnancy, and what is ectopic pregnancy? When does it happen?
Okay, the causes of miscarriage, just like every other disease or every other problem in medical science, is unknown, but we have risk factors.
Okay,
these things that can predispose one to miscarriages. Some could be some congenital abnormality in the baby, that the sperm fertilized was not healthy, and then God decides to help you, it comes out on its own. Sometimes it could be incompetent cervix. Your cervix is not enough, it's not mature enough. Common in people that are younger, that's the younger age group. So it could cause a miscarriage to happen. Sometimes it could be stress and some drugs that you take during pregnancy that is not prescribed, some unprescribed drugs. Even the prescribed ones could actually pose a problem to you. So you have to, which we still stress on the importance of coming to the hospital. And some lifestyle, like drinking alcohol, taking alcohol during your first trimester is very risky. It could expose you to miscarriages. Lifestyle changes, smoking is not healthy for first trimester pregnancies. While you say somebody took it and survived, like I said, everybody is different. So you don't do what somebody other person do. Ectopic pregnancy is just pregnancy that occurs outside the uterus. Now this baby is not going where it's supposed to go. It left where it's supposed to go and it's going outside. And it's just like every other normal pregnancy. You could miss your period, you could have other symptoms of pregnancy, but along the line you would have this severe back pain that is unexplainable, pain on your shoulder. That would give you a sign that this is not normal pregnancy. And it's advisable sometimes that most of the time these pregnancies are taken out because it could pose a problem to your ovaries, because it's growing, if not growing in the uterus, it's growing in the fallopian tube, which leads to sometimes one of the women losing one or even both of their fallopian tubes. So that's ectopic pregnancy. Miscarriages generally just occur because of those risk factors: age, If you're, yeah, that's why we have, when we see people that are above 30 years, we call them elderly primate. It's like if that's their first pregnancy, we call them elderly primate, and that means we have to take very good care of them, because anything in their lifestyle now could expose them to miscarriage because of the hormones. You know, like I said, there's an hormone that comes down, there's an hormone that's supposed to go up. But when you're approaching a particular age, like menopausal age, these hormones interchange, and which will cause a problem in this elderly primate. So that's...
Okay, so before we go, how can someone prevent? I know that something called, I'm not so vast with the topic, but I know that there's something called birth defect. You know, somebody giving birth to incomplete babies. Forgive me for using that word. But then what are the causes and how can it be avoided?
Most times it's medications, like I said, unprescribed medications, shared medications. They prescribed it for somebody else, you took it, you know. And sometimes absence of folic acid that I talk about, you know. This the folic acid is very important for the development of proper development of the child's brain and spinal cord. So these children come out with these malformations, and sometimes it's just in the chromosomes that what the man gave to you is what you gave birth to. So yes, sometimes it's in its chromosomal abnormality. You know, that's why we call it hereditary. Did they have someone like this in the family? Was it there before? You know, that gene is somewhere. It's not totally dominant. It could just be hiding, and then in a particular generation it comes out again. So it could be from the gene. It could also be from the drugs. Most of the times it's medications. People take a lot of things during the first trimester of pregnancy. Anti-malarials, antibiotics. You just keep on taking them without knowing. And those poses kind of birth defects to the babies.
Thank you so much, Nurse Udwak. It's been so educative, all the things that you said. But then talking about the hidden gene, is there a way that you can scan to know and take it out?
Yes, that's I recommended, like, you go to the hospital, because during your while you were going for your antenatal visit, if you're doing an antenatal visit in a place like I did mine, where scan are done at every visit, you'll be able to detect early enough at a point where you can just decide, make a conscious decision. Okay, I don't want stress, I will not want this baby for now, let me just take it out. And it's a lot easier than having to go through the rigorous journey of pregnancy, and then you're coming here to struggle with a child because you didn't attend your antenatal visit properly as you ought to. So that's the best way to prevent. And another way is just go to the hospital when you're ready. Before you're ready, when you want to conceive, know that I'm ready to conceive. You go to the hospital, book, like, research. I see women nowadays asking on Facebook, which gynecologist can I go to? Where can you recommend for me? People come and recommend. You wear your cost, you check your pocket, and then if I'm able to go here, you can trust this person with your information, and then you let them know everything. When you come to us, we ask you everything. Did they have any medical history in your family? Any surgical history? Any family? Anybody has twins? You know, just trying to checkmate everything. We are not God, but then we try to see how much we can help. Yes. So that's the importance of coming for your antenatal visit and just letting the doctor know.
Okay, so with that, that's all we are going to have for you on this particular segment. We are focusing on the first trimester. So today we're just talking about everything that happens during this period. But before I let Nurse Udwak go, because if left for me, I could keep her here all day. And I know that you also have questions that you love to ask us. So you can drop them on our comment section, and then we'll read it out and then get back to you. But before you go, what is your last word to women in their trimester period?
Well, my last word would be that you should just know yourself. Don't take advice on social media. Yes, when you're ready to a pregnancy, I read somewhere that somebody wrote that before you venture on a journey of pregnancy, be sure you're ready. You're mentally ready. You're emotionally ready. You're financially. You can never be totally financially ready, but there's a level of money that you should have, so you know that I'm ready for this journey, so you are not stressed out. Because when you don't have what you want per time, you will definitely be stressed out. All these economic social factors could affect what happens for you and to you during pregnancy, especially the first trimester, which could be very stressful. Sometimes you might have to take some time off work and stay back at home. So imagine you are someone that is doing business, and then your business is not moving during this first trimester. Can you cope? Can you manage? So it's pertinent that you really sit down, think on this thing. There's no rush in, people say time is not yours. Nobody will come and take care of you and your child if you don't take care of you and your child. So you have to be mentally ready There's no competition in childbirth and pregnancies, honestly. There's no need to say, I want to have all my children at once and rest. No, this is you. Have a child that you can take care of, so that when you start on that, I see women beat their children, and I know that it's not because the child did something wrong, it's because of the stress. You're stressed. African mothers. You're stressed. And then with the high cost of transportation now, imagine you having to pay transportation for 3 children when you were not ready. You are still stressed. So you have to calm down, relax. When you want to go for a pregnancy journey, make sure you've calculated the risks and the benefits. The risks and the benefits. Don't come to the hospital and embarrass yourself because you don't have money, or you did not make proper investigation before starting a journey. Look for a good hospital, register, talk to your consultant. Your consultant is like God. You tell the person everything. You don't hide something from your doctor if you must get the help you need. And when they tell you something, please, yes, don't, the first reaction is always denial, I know, but don't totally counter and make it look like the person is satanic. No, they have seen that thing and they're telling you. It's mostly common when we tell women, oh, you're HIV positive. The first reaction is always, I will never come back to that hospital. It is not possible. But then they actually saw it. You might live in that denial, but please come back to the hospital. Let us help you go through that journey. So everything about pregnancy and how you go through it, it's you, your journey, not another person's journey. So don't look at the next person. Do you. Focus on you. Understand your body. Understand your hormones. It's okay for you to feel bad that somebody else is giving birth through normal delivery and I'm going to use CS. Both of them are methods of delivery. Okay. Yes. And they are both safe. And just know that the aim of every pregnancy journey is you and your baby alive. So that's my last words.
Thank you so much. That's a lot. I mean, she has literally said my mind. So with that, wrap up package for you on well-being today. This series continues because for me, I would basically love to know what happens after first trimester. What else after obeying all the rules in first trimester? What can you do in the second and the third? Finally, we get to give birth to this bouncy baby girl or boy or twins or triplets. But for me to you, goodbye for now. And remember to follow us on all our social media handles at Spectrum TV Live.ng. I am Imogen James, your health anchor, and I'll be so glad to be back here same time, same station. Do have a lovely day. Goodbye.